Good evening. Thank you all for coming out here tonight. And I first want to just simply acknowledge you guys as being here tonight in this wintry weather out there, to take the time to not only invest in yourself, in your knowledge, but in your health with your time here tonight. So we've got the next 90 minutes together, and I'm going to promise to make the most out of it. So by the time that everybody leaves here tonight, you are all going to understand what causes allergies, what causes asthma, and food sensitivities, but not only that, what you can actually do to correct that and take action steps that you can start implementing tomorrow at home, okay? So, tonight, we're gonna start with the more things that people understand in culture about allergies, asthma, and food sensitivities from a symptomatic perspective. So we're going to kind of review and go through all of that, and then we're going to turn the perspective a little bit and look at it from how I've been trained as an internal health specialist of the functionality of how the body works and what is causing these issues from a different perspective. So I want you guys just to have an open mind tonight, and feel free to ask questions as we go along if you have something, because the more questions that you asked, I'm sure somebody else might have that same question and we can all learn from it. And sometimes too, I learn from the questions that you ask as well. So feel free to ask any questions. So tonight's agenda, turn this on. So we're going to shift our community's consciousness from a disease care model to that of a wellness model, to inspire and empower you to fully own your health. The thing about health is just like happiness. Who can really make you happy? Nobody. You have to make yourself happy. And it's the same goes for your health. You are 100% responsible for what happens to your health. And then for you to share this information with your family and friends and the people that you care about who may be suffering with this as well. Because one thing that I say over and over is that people simply do not know what they do not know. And when it comes to allergies and asthma and food sensitivities, they think that medication in the medical community is their only option. And that is simply not true, as we will uncover here tonight. So we're going to start by getting some clarity. We're going to get clarity around seasonal allergies, asthma, food allergies, and food sensitivities. So before we get into this, I want to hear your guys' thoughts. What do you guys think causes allergies? Poor immune systems. Okay. Hereditary. Okay. Any other thoughts? The environment. Okay. What about asthma? Ditto. Same things, right? Okay. What about food allergies?
The stuff they're putting in food now.
The stuff that so the quality of the food. I would agree with that, and we'll get into that. What about food sensitivities?
Diet, what you eat.
Okay. So these are all good questions. And this is what we want to find the answers to. So if it really is a poor immune system, then what causes your immune system to become super sensitive? Why are some people plagued with these issues and not others?
I think they were sheltered as kids.
Sheltered as kids.
Like parents wouldn't let them go play and get all of the
Yeah. So
yeah,
yeah, and there definitely is some truth to that. Like all the antibacterial soaps and the hand sanitizers, like we need our immune system. I mean, how do you strengthen your immune system? You've got to challenge it. Why do you think kids are always putting things in their mouth? They're trying to inoculate the germs and the bacteria so that their immune system can actually be strengthened.
So we let them eat whatever, right?
No. Tide Pods are not in there. So, So can these issues be prevented? Or is management the very best that we can do? All good questions. You ever feel like this? So to understand the immune system, the immune system is a very complex system, and there's so many different sensitivities and mechanisms and things like that, but I want to kind of take you through a brief concept of what an immune complex is so that you can understand what is triggering the allergies and things later. So first we want to talk about an antigen. And an antigen is a harmful substance. It could be a toxin, it could be a protein or other foreign substance that enters the body and causes the production of antibodies. So an antibody generator is actually how they get the word antigen. So what is an antibody? An antibody is known as an immunoglobulin that is produced by B cells that then is stimulated by an antigen. So to understand this, and I really want you guys to focus on this word here, protein, because that's going to come up later in the talk. So let's just imagine that this is a protein, okay? You're eating this, or it's in the air, let's say it's pollen, and you're allergic to this. So it comes into your body, your immune system recognizes this as a foreign invader. It is non-self tissue, or a non-self protein. So what does it do? It tags it with an antibody. This has now become an immune complex. And what does an immune complex do? These antibodies tag it to say, hey, foreign invader, it's going to stimulate other white blood cells to come and digest this and literally gobble this up and digest it with enzymes. So that is what an immune complex is when we're talking about antigens and antibodies. Okay? Make sense? So, what are different types of antigens? Well, we've got two basic types. We've got microbial, which is your bacteria, your viruses, and your other microorganisms like fungi and protozoa. And then you've got your non-microbial, which are proteins from egg whites, dairy, gluten, pollen, pet dander. Perfume and smoke is where your toxins and your chemicals are at, but also tissue transplants and injected proteins are all forms of non-microbial antigens. So we're talking about some of the most common triggers for allergies. We're talking about tree, grass, and weed pollen, mold spores, dust mites, pet dander, and this one I found weird, cockroach. Like what? So some sort of like residue and stuff from cockroach, I guess typically people can have a reaction to that.
Probably something they're carrying in.
Yeah. So what are the common symptoms for that? Well, you've got your regular nasal stuffiness, sneezing, itching, clear discharge, and then itching of the roof of the mouth and or ears. So there's nothing new there. We all pretty much know that. We're talking about asthma. We're talking about obstructed airway, coughing, wheezing, shortness of breath or rapid breathing, chest tightness or chest pain, and occasional fatigue. Okay? So there's nothing new there. Give me something. I'm suffering terribly from an allergy to humans. All right. Food allergy versus a food intolerance. And there is a difference. So what is a food allergy? If you have a food allergy, it's a disease of the immune system, and it's an exaggerated response to a certain protein in certain foods. And then these can either cause life-threatening reactions by a microscopic amount when it's either touched or inhaled. So if you have a food allergy, it affects part of the immune system that lets you know within seconds that you've got that allergy. Okay? A food intolerance is a little bit more difficult to kind of uncover because it affects a different part of the immune system, and reactions in your digestion system. So where's 80% of your immune system located? In your gut, exactly. Why is 80% of our immune system located in our gut?
That's how 80% of the stuff gets in our body.
Very good. It's the first line of defense, exactly. Because our gastrointestinal tract, even though it is physically inside of us, it is considered an external environment. In other words, I can have a penny in my hand and close my hand around it. Is that penny inside my body? No, it's in my hand. So our gastrointestinal tract is an external environment, but it's physically located inside our body. Something doesn't become a part of our body until it crosses a cell membrane. Then it becomes part of our body. And that's why 80% of the immune system is located there. So when we're dealing with a food intolerance, you have a reaction in your gut that's occurring that stimulates that inflammatory response, and it affects a different part of your immune system that actually has a window. It's called a delayed onset reaction that has a 72-hour window. So you could eat something today and 2 days later have a reaction to it, which is why it can be more challenging to figure out what a food sensitivity or an intolerance actually is. Make sense?
So that's like food poisoning?
Food poisoning, you would know. Well, yeah, kind of, depending on what's what. Because if it's an immediate reaction, but yeah, it could happen several hours later, sure. Absolutely.
So if you eat like too much dairy products and then you feel it
Mm-hmm.
at night or whatever, you're just feeling it more than the 72 hours. It's
Exactly.
not 72
Yeah,
hours.
you have there's a peak window of 72 hours for your body to react to it. Okay? It's like my sister, like she loves shrimp, but she has an allergy to it. And she knows that she can have about 3 or 4 shrimps, and then her lips and her tongue starts to tingle. So she knows, all right, I had enough. So, and the threshold for everybody's body is different too. Because if you have an allergy to dairy, some people can drink a cup of milk and not have an issue. Some people have a sip and they'll react. So everybody's body's threshold is different as well. So what are some symptoms of food allergies? Well, we got itching and swelling in the lips or tongue, tightness in the throat with hoarseness, nausea, vomiting, and diarrhea, occasional chest tightness, wheezing, hives or swelling of the skin, and if it's really bad, anaphylaxis and having a systemic reaction. So these are all pretty common. We all know this. But what I want to do is take a step back and let's see if we can start to develop patterns in what's actually happening in the body so that we can understand what the body is trying to do. Because when you go to your medical doctor, they're just looking at symptoms and at a very small part of your body. So if you have sinus stuff, you go to an ear, nose, and throat guy, and that's all he's looking at, okay? So they compartmentalize the body, but just because you have a certain symptom in a certain area of your body doesn't mean that that's what's causing it. It can actually be the compensation. So when we're looking at these, let's kind of categorize this into different organ systems. So itching and swelling lips or tongue, hoarseness and tightness in the throat, nausea and vomiting and diarrhea. So what system is that affecting?
Which one?
All 3 of them. Your GI system, right? Tightness, chest tightness and wheezing. What's that affecting? What organ? Lungs. Hives or swelling of the skin. Oh, that gives it away, the skin. So just kind of keep that in mind because we're going to come back to that. So we got GI, lungs, and skin. So we've got certain food allergies, which these are the most common 8 foods that cause people to have allergies. So when somebody is sick or has a chronic issue, what's one of the first things that they try to improve with their diet? Eliminate what? Dairy, right? That's usually one of the top things on the list. Well, why? Don't we need milk? We don't? Okay. I agree with you. I'm just making you guys think. You guys think you're going to come in here and just, have a free download. So milk, when it comes to cow's milk, and I don't want to get disgusting or anything or graphic, but we should not be drinking cow's milk anymore as humans. There's no need for it. It is nutritionally devoid of any nutrition for our bodies because it's the way that they actually produce the milk now. You have a cow that they pump full of growth hormone. So the whole point behind giving them growth hormone is for them to produce more milk in a shorter period of time. So they're really taxing the cow's body to do more production. Well, when that happens, the cows get sick. They get infections. So what happens? They got to keep these cows pumped full of antibiotics. So you get growth hormone and antibiotics, and now that cow is producing milk. Well, do you think any of that is getting into the milk? Say yes. So it's getting into the milk. Once it comes out of the cow, then what do they do to the milk? They ultra pasteurize it. And what does that do? They heat it to a high temperature so it kills all of the bad stuff that's in there. Well, do you think if they kill all of the bad stuff, do you think they destroy all of the good stuff too? So we should no longer be drinking cow's milk at all.
What about organic?
Organic is definitely different, and it's better, for sure. But I still wouldn't... the best form to drink milk in is raw milk, because that is actually a health food. But it is illegal to get and sell raw milk in a lot of states. So go figure, it's a health food, so let's make it illegal for people to get it. But that is actually the best way to get it. And I looked in Illinois here recently, and there are some certain drop-offs. You can have a pickup of like getting raw milk like once a month and stuff. So it is available here in Illinois. But I would just avoid it altogether.
So if I want a good bowl of cereal, what would you recommend?
Almond milk or rice milk.
I've had rice milk.
Yeah, rice milk is definitely,
I tried.
yeah. I like almond milk better because it's got a little bit more substance to it. Rice milk's very watery, but
Coconut milk good?
yeah, coconut milk is good too. Sure. Just make sure that it has the organic seal or the non-GMO verified label on it, because that is really the only way to go now. And I was watching this one lecture on the scientist talking about like the dairy industry and milk and stuff, and he basically described it as that cow's milk nowadays is rocket fuel for cancer. So if you want to get cancer, keep drinking it. And I thoroughly believe that. So soy, what's wrong with soy? Soy is in everything, exactly. But what's the problem with soy? 93% of soy made in this country is genetically modified. That's what's the problem is. If you can find an organic, minimally processed soy is actually a health food for the body. But when it's genetically modified, it's heavily processed, and it doesn't have the nutritional value that we need. Wheat. What's wrong with wheat?
Goes to your waist.
What's that?
Just goes right to your waist.
Okay. So wheat is kind of the same thing. It's been hybridized and genetically modified to a point where it is so heavily processed that it freaks out our immune system once we eat it. So do you guys, if I say genetically modified, do you guys understand what that means? So basically you're taking the DNA of one species, let's say a bacteria or a virus, because you like this certain trait that this bacteria has. So we're going to splice the DNA of that trait that we want, and we're going to insert it into this tomato or to this corn. And we're going to create a whole new strand of DNA. So when you do that, then that crop can perform the way that you want it to, and it can become herbicide resistant or pesticide producer so that you can actually grow more of that. So then you can spray Roundup on it, which they call Roundup Ready crops, which the active ingredient in there is glyphosate. So when you're spraying Roundup on there, you're killing all the other weeds, but that produce or that crop is resistant to it and can flourish in that environment. But the problem with that is that you've got this Roundup residue that is on there. So half of the problem with wheat and gluten is that it is heavily processed and it freaks out our immune system. So that's why people are gluten sensitive. The other half of that is that you're just eating the poison, that Roundup. So you're actually consuming that, which is then destroying your gut. Okay? Fish and shellfish, there's a protein in there, tropomyosin, that certain people react to, like my sister. What about eggs and peanuts? Where are these allergies coming from?
I would assume eggs would be similar to milk. I would assume.
So think back when we were kids growing up. Did we have any peanut allergies? No, they didn't even exist. So it's booming now. Every kid, all the schools are nut-free zones. Why? Think it just happened? It's from the vaccines. There's peanut oil in the vaccines that they're giving the kids now. There's egg protein in the vaccines. How does stuff get into our body? How is our body supposed to process it? Through natural means, right? Through our gastrointestinal tract. Well, you put something into a syringe and inject it into the body, you are now forcing that immune system to respond. You're not even giving the body a chance to process it appropriately. It has to. And that's where all the sensitivity comes from, let alone all the other poisons and toxins and heavy metals that are in those vaccines that are destroying kids' brains.
Going back to the eggs,
Yeah.
are you saying that you need to minimize the amount of eggs that you eat?
If you have a sensitivity to it, yes.
Oh, okay.
If you have a healthy body, right, we all know somebody that has a very sensitive gut, right? That they're very sensitive and careful of what they eat because it affects them badly. But we also know people that have rock iron guts. They can eat anything and nothing affects them. So it all depends on what's going on specifically with your body. That's a great question. And then the tree nuts is just a molecular mimicry from the peanuts. So in other words, the molecules and the protein in the tree nuts are very similar to a peanut, which then the immune system can't distinguish the two, so it reacts to them both. Okay? All right, most common food intolerances. Cow's milk again, gluten, wheat, which we've just discussed. Food additives and preservatives. Here's your food coloring, right? Your red lake number 40, your blue dye number 1. And then natural curling substances like caffeine are the most common food intolerances. So symptoms, again, stomach and bowel upset, bloating, headache and migraines, wheezing and a runny nose, hives, and general feeling under the weather. Very similar to a food allergy, isn't it? So again, what systems are these affecting? Well, you got GI tract, well, your head, wheezing and a runny nose, so again, your lungs and your sinuses, hives, which is your skin, and then a systemic effect. The thing about this is that when you don't have a stomach issue or a digestion issue, we kind of take it for granted. But when you have a lactose issue or a gluten issue or a dairy issue, it really impacts your life. I had this one patient that came to me that was 6'2", 145 pounds. He got the flu one year and never recovered from it. So he was on disability for 10 years before he came to see me. So he was in his early 30s. And he had his system was so sensitive and so messed up that he ate such a narrow diet. And if he ate anything that was outside of that, it would literally, physically put him in bed for 3 days. So I worked with him over the years, and it took about 3 years or so, but we got his GI tract straightened out and stronger, and we actually put about 45 pounds on him. But it took time. So we don't realize how we take for granted things when things are just functioning fine. But when we lose it and lose the ability to do that, it can severely impact our lives. So how do we treat allergies? Well, based on what your tests are, there really is only two options, right? Avoid the allergens or the environment, modify your diet, so diet and lifestyle, and then medication, right? You take medication, you get an allergy attack, oh, let's take a decongestant. If we have an asthma attack, we take an inhaler. So we wait for the crisis to happen before we actually do anything about it. So some statistics on this is that 50 million Americans suffer from all types of allergies. So that's 1 in 5 Americans. Allergy is the 5th leading chronic disease in the United States among all ages, and the 3rd most common chronic disease among children under the age of 18. And it costs $14.5 billion a year to treat. So going back up to that second bullet, the one thing that shocks me, I've been in practice for 16 years, and when I first came into practice, having the word kids or children and chronic disease in the same sentence never occurred. But now kids all over the place are having chronic disease issues like allergies and asthma and eczema and digestion issues and ADHD and all these other things. So why are our children being plagued with these chronic diseases? There's 2 causes from my perspective. One is the vaccines that we're giving them, because when we grew up, in the early 80s when I grew up, from 0 to 18 years of age, we maybe had 12, maybe 16 vaccines. Now, if kids follow the recommended CDC schedule, they're starting their vaccines when they're in utero, and by the time they're 18, they're getting 70 plus shots. And there's no single ingredient in any vaccine that actually strengthens or fortifies your immune system. So that's one cause. And the second cause is how adulterated our food is. We're not eating food anymore. We're eating food-like substances. So from this disease care model, so again, what causes allergies? Well, it's the environment or it's hereditary, right? What causes the immune system to become super sensitive? Well, it's the environment. It's hereditary, right? Why are some people plagued with it and not others? Well, it's hereditary. It's what they've got. Can they be prevented? Not from this model. Management is the only thing that we can do. And when you have this type of approach, I call it defensive health. We're waiting for something to happen, we're waiting for a crisis, and then we're going to react to it. Now, don't get me wrong, I'm not saying that this is wrong or bad, it's just one way of looking at it. So, to kind of review what we just went over, I want to switch hats a little bit. So if it's the environment, the allergies, the food that we're eating that is affecting the body, well, let's look at it from the body's perspective. What is the body trying to do when we have these types of things? So what organ systems are actually affected? Well, when we have sinus issues, it's the sinuses and the immune system. When we talk about asthma, lungs and the immune system. Food allergies, GI system, skin, lungs, and the immune system. Food intolerance, same thing. So when it comes to health, every single cell in your body only asks you to do 2 things. Give me my food so I can create energy and do what I'm designed to do, and take away my waste. If you can do that, that cell, that tissue, that organ system will be able to do its job very efficiently for a long period of time. But if you can't deliver the nutrients or you can't take away the waste, that's where problems arise. So when we look at the body on a whole, there are 4 organs of elimination in the body and how the body gets rid of toxins. We've got your colon, your large intestine. we've got our kidneys, we've got our skin, and then we have our lungs. And the sinuses aren't necessarily an organ of elimination, but it is a pathway for the body to get rid of toxins. So when you have allergies, asthma, food allergies, or food sensitivities, your body cannot process the food or the environment, which is then causing the internal environment to become toxic and stress the organs of elimination. And we'll get a little bit deeper into that in a bit. But does that make sense to you guys? Okay. So what if I were told you that there was one condition that caused all of these issues? Would you believe me? Any of you have this at all? Stress. So what is it about stress? Well, before we get into some solutions, let's talk about that allergy survey that you guys filled out. So that first category there, that first box, is a list of symptoms. So by a show of hands, how many of you have at least 2 or more of those symptoms on a frequent basis? Okay, almost everybody in the room. So when you have those symptoms, does it make you feel good? Are you able to do your job and function as a family person? No, it affects your life. So why does our body give us symptoms? It's reacting, okay? Any other thoughts?
That's a good one.
Telling us that something's out of balance.
It's the way the body communicates to us. Hey, here's your check engine light. So are you the type of person when that check engine light comes on in your car that you take it right into the mechanic, or do you wait a month or 2? Right? So why don't we do that with our body? Right? So the average person will spend about $2,000 a year to repair and maintain their car, yet they won't spend a dime on themselves or their health. We can always get another car. We can't get another body. Yet. Wishful thinking, I like that. So, let's peek behind the curtain. Let's see what we can find. Let's switch perspectives. So instead of coming at the body from a compartmentalized organ-related issue, let's look at the body as a whole and figure out, well, what is causing the body to have these things? So Dr. Hans Selye was a medical doctor that spent 50 plus years researching stress and its effects on the human body. He wrote 1,700 papers and 39 books about stress. He was known as the father in stress and was nominated multiple times for the Nobel Peace Prize. So needless to say, this guy had a brain on him. Selye's conclusion from the whole thing, all 50 years, is that stress is a specific entity. So when we talk about stress, that word stress gets thrown around. What does it mean? Can we define it? What do you think?
Something just before a breaking point.
Something just before a breaking point. So a situation where there is overwhelm, maybe? Okay. It's kind of hard to define, isn't it? So when you throw that word stress around, or, oh, it was just stress, it kind of is a big, vague word, and it doesn't really have a lot of meaning. Out of your comfort zone. Okay? So to Selye, stress was very specific. To your brain, stress is very specific. And what he realized, it was the only disease we have to fight. But it comes in 3 forms. What are the 3 forms? You guys ever?
Emotional, nutritional.
There you go.
Got it.
So look at this, right? We've got M, E, N.
Absolutely.
Men. Men make us sick. Okay? So when we're talking about mechanical stress, what are we talking about? We're talking about subluxations, right? Where your spine and your vertebrae don't move appropriately, they get restricted. When you have a subluxation in your spine, not only is it going to put pressure on that spinal nerve, but it's going to send a distress signal to your brain and cause stress in your brain neurologically. Okay? And then that can set up for other things to occur. We're talking about posture, right? We're going to go over that in a moment. And then old musculoskeletal injuries, as everybody sits up correctly. That's funny. So old musculoskeletal injuries that haven't healed correctly, right? If you sprained your ankle and it never healed correctly, if you threw out your back and it never healed correctly, you have a shoulder issue, never healed correctly, you've got scar tissue and stuff that's built up, you can have neurological pathways into those muscles in that joint that can cause stress to your brain. Okay? So, what can cause subluxations? Well, lots of things. It can start from birth, which is why every baby that gets born should be checked day one by a chiropractor. Falls, car accidents, sports or workout injuries, household chores, doing repetitive motions, poor posture, and then organ-related stress. And I'm going to come back to that one in a little bit to show you that, about what I mean by organ-related stress. But these things can cause subluxations.
I'm sorry, would you really want to see an infant and like care for an infant right off the bat?
Absolutely.
And if anything goes wrong, they turn around and look at you, it's your fault.
Nothing's going to happen. I had a 6-month-old girl that came to me. She had bloating, gas, constipation, didn't sleep more than 60 minutes at a time for 6 months. She went through 7 different pediatricians, and they all said the same thing: she's on the wrong formula. So the parents changed formula, no problems, or didn't work or do anything. They brought the baby to me. She had a subluxation at the base of her skull, and her pelvis was twisted. So I adjusted her, gave them some digestive enzymes for the formula, about twice a week for about 4 weeks. Baby's back to normal. When you're adjusting a baby, it's a completely different force and technique that you're using than when you adjust an adult. But babies have spines. Absolutely. Good question. So when we're talking about your spine, we have different layers of muscle around it. So we've got your outer layer here. Then underneath the outer layer, we've got your postural muscles here. Those are the ones that help us stand upright and do lateral bending. Underneath these, we've got these rotaries and multifidi. And it breaks it down. So you've got muscles from each individual vertebrae. You've got ones that go and cross 2 vertebrae and ones that go across 3 and more. So when these muscles become tight, it's going to rotate and subluxate your spine. So this is what it can look like, right? You've got a straight vertebrae here. Look, these muscles are contracted. Sorry, it's blurry, but it's the best one I got. You can see how it rotates that vertebrae. Kind of looks like this. When that happens, you can see that it rotates and it shifts. So compared to a straight spine, when you've got subluxations and muscle contraction, it can cause your posture to be off balance. So when we take a cross section of one of these nerves, this is what we're looking at. And every single nerve that comes out from your spine has 3 components to it. You've got your motor component, which is your brain talking to your muscles. All right, lift up this bag, okay? Open up this jar, okay? We have your autonomic part, which is your brain talking to your organs. And then we've got this sensory component, which deals with posture, pain, and temperature. So this is what I want you guys to understand, is that This sensory component makes up less than 10% of all nerve transmissions in your spine and coming out. 90% of it deals with motor and organ-related issues. So when I'm out and I'm networking and I talk to people, hey, who's your chiropractor? People are like, oh, I don't have any back pain. I don't need one. I can't tell you how many times I have people that come into me that have a digestion issue or a sinus issue or an asthma issue and no back pain. And this is the reason why. Pain only shows up in the most acute or extreme situation. But 9 times out of 10, you'll have muscle contraction or you'll have organ dysfunction. Okay? Now, when we're talking about your autonomic nervous system or your brain talking to your organs, I want to point out this vagus nerve right here. It comes down from your brainstem and it innervates your heart, it innervates your lungs, your stomach, your liver, your gallbladder, your pancreas, your adrenals, all the way up into the first half of your intestines. So when you have a subluxation at the base of your skull, guess what? You've got pressure on that nerve and it decreases the vagal tone to all of those organs. So when you have decreased vagal tone going to your gut, then what happens is that your body cannot produce enough hydrochloric acid, your stomach cannot produce an adequate enzymes, and it decreases gastric motility. So there's your digestion problem from a subluxation up here at the base of your skull. Okay? So part of the job when people have digestion issues is to increase that vagal tone. And what's the best way that you can do that? Is getting a chiropractic adjustment.
How often?
It depends. If somebody's really sick or bad, I'll see them daily. If not, I usually start people off 3 times a week. I have people that come in that don't have any active issues. So we'll just go through, twice a week for a couple of weeks or a month. But then once you get to a maintenance type level, that's different for everybody too. Most people, when they're on a maintenance level, come in twice a month, once every 2 weeks for the rest of their life. So it just depends on everybody. Because I have some people that come to me once every 3 weeks, some people that need it weekly, some people that come once a month. It really kind of depends on your lifestyle and how active you are and how well you take care of yourself at home. So, good question. All right, so let's talk about posture. So forward head posture, rounded shoulders, right? Everything that we do is in front of us. There's very little that we do that's behind us. So what we see is that these shoulders become rounded and this head that comes forward. So what's so wrong about that, or what kind of problems come from that? So normally our shoulders should be back and our head should be over our shoulders. Our ear should line up over the tip of our shoulder, over our hip, over our ankle. That is the normal and the correct posture. But for every inch that your head moves forward, puts added pressure not only on your cervical spine, but tension on the rest of your spinal cord. So medical experts say that this forward head posture can add up to 30 pounds of abnormal leverage on the cervical spine, and it can pull the entire spine out of alignment. It forces the suboccipital muscles to remain in constant contraction, putting pressure on the 3 occipital nerves. So your suboccipital muscles are back here. So if you've got this forward head posture, if these muscles weren't contracted, you'd be looking at the floor all day. So they have to contract to keep your eyes in line with the horizon. The other thing is that you can lose 30% of lung capacity from that forward head posture, because the nerves that come out from your upper thoracic spine, T1, T2, T3, those nerves go to your lungs and to your heart. So if you've got this forward head posture and these rounded shoulders, that can put pressure on those nerves and decrease the function of your lungs. Do you think that contributes to asthma issues? Absolutely. So your suboccipital muscles, right there at the base of your skull, that's what they look like. If you've got contraction on one side, what does it look like? Oh, look, your ears are off. So when you go home, stand in front of the mirror and look at the bottom of your ears. If you're subluxated, you'll have one ear that's higher than the other. Okay? It should be straight and not misaligned. So to review mechanical stress, your brain communicates to your body through your nerves. Multiple things can cause spinal muscle contraction or subluxations, including posture and organ-related stress. With nerve interference, your body will allow up to 60% of dysfunction before you actually feel pain symptoms. And then forward head posture can pull the entire spine out of alignment. And it can affect lung capacity. So we're talking about organ-related stress. Get back to this in a moment. So every nerve that comes out from your spine goes to an area of your skin, a muscle, and an organ system. So if you've got a pure mechanical stress to your system and you've got a subluxation, well then a mechanical solution would correct that. So let's get you adjusted. Let's talk about posture. Let's strengthen the muscles around your spine. If it's purely a mechanical issue, then that will correct it in a short period of time. If it is only a temporary fix, meaning that you're good for a couple of days or a couple of hours or a week at best, but those symptoms that you have come back at the exact same spot and the exact same intensity, then that is an organ or a nutritionally related issue. So once you get that organ the nutrition that it needs, that will then loosen up that muscle contraction in your spine. So we're talking about organ-related stress. That's what I'm talking about. Does that make sense? Okay. Emotional stress. Who here has zero emotional stress? Caught you there. So we're talking about emotional stress. What are we talking about? Well, you've got relationship issues with others, but also yourself. We have this inner critic. How kind are we to ourselves?
Not enough.
Yeah. Step one is admitting it.
Or reality.
Because if we had a friend or a family member that talked to us the way that we talk to ourselves, would that person be our friend anymore? No. So why do we think it's okay for us to be that bad to ourselves? It's just part of human nature, that's all. And then you've got anxiety, depression, overwhelm, financial issues. But we're not going to get into the nuts and bolts of this. I really want to hit mechanical and nutritional stress with you guys here tonight. So we're talking about nutritional stress. What are we talking about? We're talking about two things. Number one is the quality of the food that you eat, which is what you hit right on the head.
No cow milk,
No cow milk. Didn't mean to scare you, but it's the truth. Because the way we have genetically modified foods and artificial sweeteners and food dye and everything, organic is really the only way to go. So it's obviously the quality of the food that you eat is important, but here's the kicker that most people don't understand. How well can your body digest, absorb, and actually utilize the nutrition from the food that you actually eat? I have so many people that come in to see me all the time that eat a very clean diet, lots of fruits and vegetables and organic. They exercise 4 or 5 times a week, but yet they still have all these health issues. So it's not a question of their lifestyle. It's a question of how is their body functioning. And their body can't do what their lifestyle is trying to tell them to do. It can't perform and it needs help. Okay? So the quality of your food, right? Your standard American diet, or SAD. It's very sad. Processed food, artificial sweeteners, food colors and preservatives, and your genetically modified foods. So how many families are just eating nothing but this stuff? I mean, my daughter is 11 years old, and it's hard to get her to eat fruits and vegetables. Because when she's out with school and things, She's exposed to those other things. But it's just part of living and life.
Finance is cheaper.
So why is it cheaper? That's a good question, and it's a good point. So why is processed food, why does McDonald's have a $1 menu?
To draw you in.
Exactly. So why is organic and healthier food more expensive?
Because it costs more to produce it.
Exactly. Because conventionally raised crops are subsidized by the government. Organic farmers don't get subsidies, and they have to pay to prove that there's no chemicals in their crops. That's why organic's more expensive. So you either pay the farmer now, or you pay the doctor later, and more time and suffering. It really is your choice.
Go plow a garden like farm.
So when we eat processed foods, we are eating enzyme deficient foods, which are inflammatory. Why can a food packaging company package up a box of food, it sits on a shelf, you go into the supermarket and buy it and you prepare it at home and you think it's actually nourishing your body? What's different from a processed food or a packaged food versus a raw fruit or vegetable? What's the difference? What? Okay. What else? Soy.
Well, it stays good longer.
Yeah. Exactly. It's got a longer shelf life. Because when you process food, you remove the enzymes. If you had a box of a dozen organic apples and it sat on a shelf for 4 weeks, and you went by, or even a week, and you come by and you buy it and take it home and it sits in your pantry for another week or week and a half, what are the chances of that spoiling? Pretty high, right? Why? Because of the enzymes. Enzymes are what make it alive. Processed food is dead food. Raw fruits and vegetables contain enzymes in them, and that's what makes it alive, and that's what makes it nutritious. Because the enzymes put everything together. When you eat enzyme deficient foods, you're asking your digestion system to cough up more enzymes to digest it. Well, what if your stomach can't do that? What if you've got a subluxation and decreased vagal tone? It ain't gonna happen. So then who's got to clean up that mess? The wife. That's funny. No, what else is located in your gut? Your immune system. So every time you eat something that your stomach can't digest, guess who's got to clean up that mess? Your immune system. So could it be possible that if we are eating every meal and we can't digest our food, that we are chronically stimulating our immune system and making our immune system hypersensitive and forming immune complexes? Starting to see the picture? Artificial sweeteners, your Splenda, your NutraSweet, your aspartame, they're all neurotoxins. They literally put holes in your brain. Food coloring, preservatives, carcinogenic. GMOs, carcinogenic. I promise it's not all bad. It really isn't. But this is the truth. And people don't know this, which is why I'm up here doing this. So these are all nutrient deficient foods. They are food-like substances and chemicals. Have any of you ever had a project to do, whether it was cleaning out the garage or painting a room or some sort of yard work that you had to do at home? Anybody have a project like that? That was intense but for a short period of time? Like a day, 2 days, 3 days, a weekend? So what were you like at the end of that when you kind of hustled through and barreled through that? It was kind of exhausting at the end, right? So what if you had to do that same project, only this time you couldn't eat at all? How would you feel? How would you function? Would you be able to? Well, when your cells and your organs can't get nutrition, that's what they're doing. They can't do their job. And that causes a wrench in the whole system and can cause problems. So, weak digestion. Subluxations decrease vagal tone to the stomach, which we've talked about. Emotional stress or overwhelm can cause it. Poor diet. Large portion size meals. You got the buca de beppo, right? Family size portions. Let's eat.
That's bad.
That's bad. Because when you sit and you eat, and you eat, and you eat, and you eat, until you can't get up from the table, who's got to clean up that mess? Your immune system. Right? You're not going to be able to digest all that. So when you have portion-sized meals, your body and your system can better handle and digest that and process it. Oh, here's a good one. How many of us take 3 bites and swallow our food whole? Our stomach does not have teeth, so if you don't mechanically chew your food, it's going to be rougher on your system. So when you sit and eat, sit and eat. I mean, eating is fun. Who likes to do that? So when you sit and eat. Chew your food, savor it. The problem is that we don't have the time. We're always eating on the run. And we grab something to eat and we take 3 bites and we swallow it whole and we wonder why we got stomach issues or chronic health issues. That's part of the reason. Enzyme deficiencies. When you've got subluxations, you're going to make less enzymes in your gut. When you eat more processed food and genetically modified foods, you're not going to be able to digest that. So do you realize when you eat a genetically modified food, because you have 2 DNA that have come together, and now that sequencing is producing new proteins in that food that our body does not have enzymes to digest. This is why genetically modified foods are bad, because we can't digest them because of that. One-time event of stress, so we could have something severe happen to us, like the loss of a loved one or a breakup or loss of employment, but also chronic stress over a prolonged period. So it can be big stress in a little bit of time, or it can be little stress over a long period of time. Any one of those can cause our digestion system to become weak. So weak digestion leads to leaky gut syndrome, dysbiosis, and constantly stimulating your immune system. So we're going to get into what leaky gut's about. Anybody here heard of leaky gut? You know what that's about? Okay. So we have our small intestine. You got the lumen that then is broken into this. And these are your columnar cells and your small intestine. And on top of your columnar cells is the microvilli. This is where all the absorption occurs in your small intestine. Okay? So this is just kind of to show you what happens in the small intestine there. So to blow that up, this is what it looks like. So this here is the lumen of your stomach or small intestine. Here's your bloodstream. So when we have leaky gut issues, we're talking about inflammation. So if you have weak digestion or eating processed food or sugar, or there is inflammation in your gut, then you can have one of 2 ways here. We've got these tight junction proteins here that break open, or you actually damage the cell itself, and things that are undigested and toxins that are in your lumen that should stay there can now leak across your system and get into your bloodstream. Look, there's an antibody right there. Okay? So you got all these toxins that are getting in there, and this is how ulcers happen in your stomach. So when you have that, you've got big pieces of undigested food that your immune system's going to tag as a foreign invader. There's your immune complex. Okay? You're going to have inflammation and activate your immune system. So this is kind of what it looks like when you eat. Is it just goes right through you and it gets into your system. It's not supposed to be there. So what causes leaky gut? Well, your standard American diet. We're sad. Right? You got food triggers, GMOs, soda, alcohol, NSAIDs. You know when you take a Tylenol or an aspirin, 1 capsule, causes microscopic bleeding in your stomach for 72 hours. Antibiotics, right? Stress, heavy metals, toxins, pesticides. So leaky gut turns into food intolerance, which then turns into immune abnormalities, which then leads to about autoimmune conditions in about 5 years. Symptoms of leaky gut syndrome. There's lots of them. So there's all kinds of things that can happen that can affect your entire system. So what happens? We've got a cascade of poor diet and weak digestion. Well, it comes from poor food choices, not thoroughly chewing your food, weak digestion or vagal tone, contributes to leaky gut and dysbiosis. You ever heard of dysbiosis before? You know what that means? So in our small intestine and in our large intestine, we've got bacteria. We've got good bacteria. We've got bad bacteria or opportunistic bugs. We also have got yeast down there. So symbiosis means that everybody down there is happy and in balance and is actually beneficial for us. Another word for this is a probiotic or your normal flora, right? Everything is happy-go-lucky. So we need those good guys down there because there's a lot of byproducts that they produce from eating the food that we eat, especially the fiber from fruits and vegetables, that is very beneficial for multiple systems in our body. But when we are under stress, when we don't chew our food, we have leaky gut issues and inflammation. This gives the bad guys an environment to flourish. So now you've got the bad guys that are growing more than what the good guys are. When that comes out of balance, that's what dysbiosis is. It's an imbalance of the flora in your gut, which is not a good thing. So who's got to clean up that mess? You got your immune system, but all of the stuff from your gut gets shoved right into your liver. Your liver has to detoxify all of that. Your spleen has to detoxify all of that. Those are two big filters in your body. And then the last one is your kidneys, right? Your kidneys have to filter out the blood too and excrete the toxins. They're actually an organ of elimination. And your immune system. So when you've got weak digestion and all of this, it makes your liver work harder, it makes your kidneys work harder. And when these two filters can't do their job, then what happens? Your lymphatic system becomes congested. The organs can't keep up with the work, got lymphatic congestion and toxicity, and then it stresses your organs of elimination, right? Kidneys, lungs, skin, and your sinuses. What else were we talking about that has issues with the lungs and the skin and the sinuses? So can you see why stress can affect your gut, which can affect your small intestine, which can then clog up your lymphatic system, and then stress the organs of elimination? So if you've got these immune complexes that are deposited in your sinuses, and then you just happen to walk outside and breathe in all that pollen, there's your allergy attack. If it's sitting in your lungs and you're breathing that in, there's your asthma attack. Make sense? So, let's strengthen your digestion system. How about we start there? The very first thing that needs to be done is the management of the stress. See, the thing is that there's a certain sequence that has to occur in order for healing to take place. If I'm a dog and I'm chasing a rabbit in a field, what are the chances of another rabbit popping up? So then which one do I chase? Do I chase that one or do I chase that one? So the rabbits are like symptoms in the body. I don't chase symptoms around the body. Medical doctors, that's what they do. They chase symptoms around the body because that's what they're good at. They're good at crisis intervention. Now, don't get me wrong, I'm not trying to knock the medical profession. They are really good at crisis intervention or disease management. But when it comes to health and healthcare and chronic issues, they don't have a clue. Because the best thing they can do is just give you medication for the symptoms that just mask the symptoms. So I don't know if you guys understand this, but medication does absolutely nothing to restore normal function or to even promote healing in the body. It just doesn't. Okay? So stress management is the very first thing that needs to be done. Well, how do we identify where the source of stress is? Well, it comes in three forms. What are the three forms?
Physical, emotional, and nutritional.
Nutritional or men. Exactly. Well, you were so excited about it earlier. That's why I was hoping you remembered it.
Or whoa.
Eating a clean diet, right? So we have to manage our stress better. We have to eat a clean diet. Let's actually nourish our body. The thing about the body is that homeostasis is on the job 24/7. It never gets the job wrong. It does it every single time. We just need to support it in a way that it can do its job. Because when you find the stress, when you minimize it, and you support normal function, the body heals. That's the best part about my job. I don't heal my patients. They heal themselves. I just show them what to do. Chewing your food thoroughly, getting chiropractic adjustments, and taking digestive enzymes. So to kind of summarize what we just went over, hey Kelly, can you bring me those 2 testimonial forms that are in there? I forgot to bring them up here. So to review what we just went over, it doesn't matter to your brain or your body what form of stress or how long it's been there. Mechanical, emotional, nutritional. Your brain and your body is going to do the exact same thing every single time. And what is it going to do? 2 things are going to happen. Thank you. You're going to burn more nutrients, so you're going to require more nutrition, and you're going to create more waste in the body. When this happens, you use up your enzymes. And what are 2 main systems in the body that are totally dependent on enzymes? Immune system and digestion. You got it. So when you...
Student, but I don't.
That's great. So when you run out of enzymes, right, and become enzyme deficient, what happens? You get inflammation. Do you think that that could super sensitize your immune system? Yep. Over time, it leads to lymphatic congestion, which then leads to chronic issues. So what happens if we were actually to identify where that source of stress was on your body? What if we were able to minimize that and help you manage it better? Because sometimes it's hard to eliminate stress. It really is. But can you turn down the volume? Can you take the pressure off just a little bit? What if we were able to find out which enzymes and organ systems were deficient and needed more nutritional support? So if we minimize that and improve this and get you adjusted or give you exercises to do at home to help take the stress off of your nervous system, do you think that your body will heal? Say, yes. Yes. Okay, so what the heck is an enzyme? Let's talk about enzymes. We've been talking about it here, but what is an enzyme? Enzymes are substances that make life possible. They are needed for every chemical reaction in the body. In both maintaining health and in healing, enzymes and only enzymes actually do the work. So what exactly does that mean? Well, if we look at the raw material that our body needs For growth, repair, and energy production, what do we have? We've got our macronutrients, which is your protein, your fat, and your carbs. You've got your micronutrients, which are your vitamins and your minerals. And you've got water. But none of those raw material have the capacity to get work done. You need the enzymes, which are the workers that put everything together. In other words, if we're going to build a house and we had a pile of all the raw materials sitting there, we have all the wood, the nails, the tools, the hammers, the shingles, the windows, the doors, the electrical. Is that material going to build the house? No, it's just the material. So if you had 2 workers working on that material, well, that house is going to get built in a certain time frame with a certain amount of efficiency. But what if we had 10 workers? What about 100? How about 1,000? 10,000 workers? You see that it's going to get built much sooner and with more efficiency. That's what enzymes do in the body. They strengthen your digestion system. They strengthen your immune system. They clean up all that lymphatic congestion so that your body can actually do what it was designed to do, and that is express health.
I'm assuming these enzymes are all through the nutrition within our body. Are there more enzyme power foods that we should focus on versus others?
That is a really good question. All raw food contain enzymes. So your fruits and your vegetables, your lean meats, and anything that's alive has enzymes in it. What happens is that when we add heat to those foods, anything above 118 degrees Fahrenheit destroys or unravels those enzymes and it renders them inactive.
So red meat is better?
I'm not suggesting to go out and eat raw meat. Okay? That's where digestive enzymes come into play in the form of a supplementation. Okay? So, how do we correct all of this? Well, we have to have some lifestyle management. And it's about creating healthier habits. Okay? Chiropractic adjustments, posture rehab, or exercises for you to do at home. To manage the emotional stress, meditation is good, journaling, exercise, talking it out with a friend or a family member. Okay? Nutritionally, eating a clean diet, chewing your food, portion-sized meals, and food enzyme supplements. Now, this is what needs to be done in order to live a healthy lifestyle. Do you have to do all of that right now? No. What I am suggesting is baby steps. Because humans, we're creatures of habit. We're either in the habit of doing something or we're in the habit of not doing something. So it's learning how to create these habits. And what I would suggest is eliminate one thing from your life or your diet or whatever, and then add one thing in. So for example, let's just take the nutrition or your diet. So if you consume soda or milk, I would suggest eliminating that completely. Can you drink more water? Can you eat an extra serving of fruit or vegetable a day? Focus on that and do that for a month until you get good at doing that. Because the problem is that we like to do 5 or 6 things at once. We can't make that change. We overwhelm ourselves and we fail. So let's really chunk it down and make baby steps. So if you can focus on one habit a month, at the end of the year, you got 12 new habits. See how easy that is? I know, it's easier said than done. I get it. So, the wellness care model. All right, so let's ask these questions again. What do you think causes allergies? Stress, right? Mechanical, emotional, nutritional. Leaky gut, posture, subluxations, men. What causes the immune system to become super sensitive? Oh, weak digestion and a poor diet. Yet inflammation and an overactive or super sensitive immune system. Why are some people plagued and not others? Well, people handle stress differently. I'll let you in on a little secret. All stress is self-induced. Because what is stressful for one person may not be stressful for another. So stress affects people differently. People have different weak links. I could have 10 people that walk into my office with migraines. There's 10 different causes of why people have that. So everybody is their own walking chemistry set. Can they be prevented? Yes. Or is managing the best we can do? We can do better. We can do much better. So this approach I like to call offensive, where you go on the offense and you actually support normal function. You manage your stress better so that your body can do what it was designed to do. So what have we learned so far? Disease care model is more defensive health. Stress causes all symptoms and health issues. Men cause it. Wellness model, or offensive health, which is where you identify, eliminate, or minimize the stress, has to happen first. Once that happens, you support the function of the nervous system and the digestion system, and your body can then heal. So can enzyme nutrition help you? Well, do you have chronic health issues? Do you want to feel better? Do you want to strengthen your digestion and your immune system? Do you want to clean up your lymphatic system, or are you looking to seek answers to your health problems? So, how do we do a digestion workup? I know you're all wondering that question. Well, there's things that we can do. There's a symptom survey that we can have you fill out online. There's a food diary. See what you're eating and drinking for 6 days. There's a 24-hour urinalysis that we can do that tells us from a chemistry perspective how your body's handling your food and what your dietary stress is like. There's blood work that we can do to see how much damage is done. And then there's a fasting digestive exam that we can do. In other words, there are 43 different stress points on your body that tell me something different nutritionally. So I have my patients come in first thing in the morning on an empty stomach. I adjust their spine to minimize all of the mechanical and neurological stress to their system. We then check these stress points to determine which ones are positive. Then we give you a balanced food to eat, which is a tablespoon of food mixed in water. We wait 45 minutes. We wait 45 minutes for allow your body to digest and absorb that nutrition. Because if these stress points are positive before, well, it's to be expected because your body's waiting for its next meal. But after you've just fed it, if it's positive afterwards, then that particular area or that organ system is having trouble at doing its job. So what if you've got 20 things that are positive before and after? Where do you start? Well, this gives me certainty of where to start and which is the highest priority. Because the thing about the body is that when you take care of the highest priority first, everything else follows the chain of command. A lot of times, most people, doctors and other practitioners, look at lower level stuff and end up chasing symptoms around the body, which is why they don't get the results. So the treatment program is not simply taking a pill that is going to heal you. It is a program, and it includes 5 things. The first thing is the stress management. This is the very first thing that needs to be done, because without this piece, the body does not heal. When you've got stress on the body, your body is burning more nutrition to combat that stress. And you literally cannot put food in your mouth fast enough to keep up with that stress. Which is why the very first thing you need to do is manage the stress better. We got to take our foot off of that gas pedal and slow the body down so that it can then heal. So this is the biggest part of it all. The second part is modifying your diet. If your body is having a hard time digesting carbs, then we don't want you eating a lot of carbs. If it's having a problem with proteins or fats, we don't want you eating a lot of proteins or fats. So everybody's different, and we'll modify your diet depending on what we find. There's a home care program where we give you specific stretches and exercises to do at home to keep the stress off of the nervous system, to minimize the muscle contraction in your spine, and helps the brain to do its job. Chiropractic adjustments, if that's what you require, and then plant supplements, enzyme supplements. So, we're almost done here. We'll wrap this up. So, 2 quick testimonials for you. This was actually my very first case out of school. I was so excited about this one. So, since high school, I suffered from frequent debilitating sinus congestion and headaches. I would have to lay down in the dark and either sleep it off or vomit until I could sleep it off. I would virtually be incapacitated for hours at a time. I went to an allergist, and after a barrage of tests, I was diagnosed with environmental allergies, prescribed Seldane, and received allergy shots for 3 years. My headaches became less frequent, but I was still constantly congested. When I moved back from college and started working, the frequency of which I got my headaches increased. I didn't have the time, ability, or desire to be out of commission for hours at a time. I have never really been big on traditional medicine and decided to go to a homeopath and a nutritionist about my condition. She put me on a rotation and elimination diet and gave me a list of supplements to take. I immediately noticed a change. I felt better and my headaches lessened in frequency and severity. However, I still had difficulty breathing out of my nose. At this point, I was thinking this was the best it would ever be. Partial congestion and infrequent headaches. Then a friend told me about enzymes and introduced me to Dr. Giaquinto. He did a digestion workup on me, explained why I've been plagued with sinus problems for the majority of my life. He then gave me some enzymes and how they worked. He prescribed specific supplements for me that my body needed, and after taking the enzymes for about 6 weeks, I woke up one morning and could actually breathe out of my nose for the first time in 16 years. I was ecstatic. Since then, my body's need for enzymes has changed, lessened, and my headaches and sinus congestion are rare. Even though this goal was to help you get your body to work properly on its own, I continue to be a loyal patient of Dr. G's. He not only gave me hope, he gave me a solution. Second one is about asthma. I had allergy-induced asthma since the age of 12. Even with being an athlete and a fitness professional today, I had recurrent bouts of asthma, which not only made it hard to breathe, but also took my energy level down quite a bit. I would also not be around dogs for very long because they would flare up my sinus and asthma. I've always had an inhaler nearby just in case an attack would begin. I had to keep my cardiovascular conditioning top-notch at all times and have taken Claritin daily since it came out on the market. I was treated by a respiratory therapist when I was first diagnosed with allergy-induced asthma as a kid, but haven't been treated any differently by any other doctor over the years. Basically, they would prescribe new inhalers for me, and that was about it. The inhalers have been consistently effective for the attacks, but were mainly an emergency cure more than one that could cure my condition. I was referred to Dr. Giaquinto by another trainer who was also seeing him. As trainers, we oftentimes overuse our bodies, and Dr. Giaquinto has put us back together again. Upon working with Dr. G, he introduced me to enzyme nutrition to greatly lessen my asthma in addition to chiropractic adjustments. I could see results very quickly once I began using the enzymes in my daily dietary regimen, and the chiropractic adjustments helped open up a healthier flow throughout my body as well. My body has grown healthier and my lungs are better than they have been since I was diagnosed so many years ago. Oh, and as a plus, I can be around dogs now without any flare-ups or symptoms. And I no longer need any Claritin. So what did I do for these patients? Well, just what I showed you. So once you find what's going on, it doesn't take long for the body to heal. The problem is you got to find the right thing that's causing it all. So now you basically have two options, right? You can continue being defensive. You have a weakened body. You can manage the environment. You can wait for a crisis to occur and then take action by taking medication. That's one choice. Or you can go on the offense. You can have more knowledge about yourself and what's stressing out your system. You can take action by creating healthy habits. You can strengthen your body so that the environment doesn't affect you. So to summarize this and say this differently is that we have 100% function. And over the years, stress kind of takes our ability to function down. And once it gets down to a certain point, this is the threshold. Once we go beyond the threshold, our body becomes symptomatic. Most people, up here is asymptomatic. Most people hover along this line most of their life. So they become symptomatic, take medication, oh, they're asymptomatic. Oh, so it's all of this. No healing occurs with that. But when you can create healthy habits and support normal function, you actually get back up to peak performance. So that's basically what I do. So you have two choices. You can do the same thing you're doing and get the same results, or you can try something new, do something different, and get different results. The choice is yours. It's all up to you now. It's the beginning. So, thank you for your attention. I appreciate that. If you guys have any questions, be more than happy to hang around for you. Other than that,